swelling, headache or a rash, asthma, colitis, fatigue, or gas. What will today's symptom be? My loopy life with lupus. Hey everyone. So it is May the 1st, and May is Lupus Awareness Month. So I've decided for the month of May, I'm going to do a video each day pertaining to various things regarding lupus. Since it's Lupus Awareness Month, I want to spread awareness as much as possible. So I have a lot of interesting videos planned that I hope you'll watch. I'm also going to be doing a couple of giveaways during the month of May as well, so keep an eye open for those. And so basically, I'm just going to start off with this video, just basically talking about what lupus is and some of the statistics of lupus. So to start off, lupus is an autoimmune disease, and what that means is that a person that has lupus, their immune system, which is used to, attack things like bacteria, like when you get a cold or a flu, your immune system attacks it to get rid of it. So what happens with lupus is that your immune system is overactive and it starts attacking healthy things in your body. And so it can attack just about any organ in your body. And so basically that's what lupus is. The short term and a nice easy way to put it. So now I'm just going to talk about some statistics, and so this is from the Lupus Foundation of America, and there's an estimate that says there's 1.5 million Americans and at least 5 million people worldwide that have a form of lupus. And what's interesting about that is that that's a large number, and yet there really isn't much awareness with lupus. Even some doctors don't have proper knowledge of it, and so it can take people years and years and years to get a diagnosis because a lot of doctors are not familiar with it. Lupus can strike men and women of all ages, but 90% of people that are diagnosed with lupus are women, and most will develop lupus between the ages of 15 to 44. But children can also be diagnosed with lupus. Systemic lupus, which is the kind that attacks the organs in the body, it accounts for about 70% of all cases of lupus. And in approximately half of these cases, a major organ such as the heart, lungs, kidneys, or brain will be affected. And then there's cutaneous lupus, which is just a kind of lupus that attacks the skin only. A good example that I can give of that is the singer Seal. He had, I believe it was discoid lupus, which is another type of skin lupus. And that's where the scars on his face came from. And cutaneous lupus affects about 10% of lupus cases. There's also drug-induced lupus, which is about 10% of lupus cases as well, and it's caused by high doses of certain types of medications. And the symptoms of drug-induced lupus are similar to systemic lupus, but they usually subside with the medications being discontinued. So it's almost like a temporary lupus, like it's not chronic where it goes on and on. Usually if you stop the medication, it goes away. Approximately 10% of all cases, individuals will have symptoms and signs of more than one connective tissue disease, including lupus. And so a physician may use the term overlap syndrome or mixed connective tissue disease to describe the illness. So again, like, lupus is very hard to diagnose because it can mimic so many other diseases, and so a lot of doctors are actually afraid to use the term lupus. They don't really want to give it the label without like being absolutely certain. 20% of people with lupus will have a parent or sibling who already has lupus or may develop lupus. So they do believe that there's a hereditary factor that can come into play. About 5% of children born to individuals with lupus will develop the illness. So that's actually a pretty small percentage, so it's not guaranteed that you're going to pass on to your child if you have lupus. Lupus is 2 to 3 times more prevalent among women of color, meaning African Americans, Hispanics, Asians, Native Americans, Alaska Natives, Native Hawaiians, and other Pacific Islanders. It's more so than among Caucasian women. It's difficult to determine the annual number of new lupus cases or the number of individuals who will die from health complications of the disease. However, due to improved diagnosis and disease management, most people with the disease will live a normal lifespan. It is believed that between 10 to 15% of people with lupus will die prematurely due to complications of lupus. The U.S. Centers for Disease Control and Prevention, they issued a report in May 2002 which indicated that deaths attributed to lupus had increased over a 20-year period, particularly among African American women ages 45 to 64. However, it's not clear if the rise is the result of an actual increase in the lupus mortality or better identification and reportings of deaths. Now, lupus also has a big impact on economics. For example, there was a study reported in 2008 that found that the average annual direct health care cost of patients with lupus was $12,643. The study's authors also determined that the mean annual productivity costs, meaning lost hours of productive work, for participants of employment age between the ages of 18 and 65 was $8,659. Thus, the mean annual total costs was $20,924. And according to the Lupus Foundation of America, 1 in 4 patients receive their health care through a government-sponsored program such as Medicare or Medicaid. 2 of 3 lupus patients reported a complete or partial loss of their income because they no longer are able to work full-time due to complications of lupus. And that's basically what happened to me. I used to work in daycare full-time, and it was just, my health was continuing to decline because the medications suppress the immune system, and so I was catching every bug that went around the daycare, and I was constantly sick, and then that stress was making my lupus. So basically, I had to make the decision to leave and stop working full-time and work part-time, and that's now I'm working as a nanny. So it's a lot easier on me to have one child as opposed to a room of 15, and the hours are a lot less strenuous on me. And then another thing was saying 1 in 3 patients have been temporarily disabled by the disease, and 1 in 4 currently receive disability payments. So that's quite a bit. While lupus is a widespread disease, awareness of the disease lags behind many other illnesses. In a nationwide poll of 1,000 adults conducted by the Lupus Foundation of America, 38% said that they are somewhat or very familiar with lupus, while 39% have only heard of the name of the disease, and 22% have never heard of lupus at all. So you can see that it's not a very well-known disease, and it's also considered an invisible disease because most people with lupus look normal. They don't look sick. And so it's a very misunderstood illness because people think you're fine and they don't realize that you're dealing with all these health issues. In another survey, only 4 of 10 young adults ages 18 to 24 claim to be aware of lupus, even though the disease often strikes during the childbearing years. While 65% of respondents to the survey claimed awareness of lupus, only 20% could correctly answer basic questions about the disease. So yeah, so it's really not known of, and that's why we have Lupus Awareness Month, and that's why I'm doing these videos, to try and spread awareness. The Lupus Foundation of America did a survey of its members, and it suggested that more than half of those afflicted with lupus suffered at least 4 years and saw 3 or more doctors before obtaining a correct diagnosis of lupus. So like I was mentioning before, it mimics other diseases and it can take a really long time. I believe I had my first lupus flare in 2002. And I was not diagnosed with lupus until 2010. Nearly half of the survey participants, 49%, they received their diagnosis of lupus after being examined by a rheumatologist, a medical specialist who treats diseases of the connective tissue. 4 of 10 lupus patients are treated by 3 or more doctors and take 6 or more medications to treat symptoms of the disease. And I will be talking about that in another video where I'm going to tell you guys what medications I'm taking, because I do have a lot, like they say here. And also talking about the whole 3 or more doctors, because I have a lot of doctors that I see too. So I'm going to be talking about that in another video. Other autoimmune diseases, 1 of 3 patients responding to the Lupus Foundation of America membership survey, they reported they had another autoimmune disease in addition to lupus, and almost half had a relative with lupus. And autoimmune diseases like lupus often do run in the families, so or at least like other autoimmune diseases. I don't particularly know of anyone with lupus in my family, but there are other autoimmune diseases in my family. Like there's been rheumatoid arthritis, there's been celiac disease, things like that. So those are autoimmune things, so kind of runs in the family, I guess. And then these are some statistics about how patients are coping with lupus. Most lupus patients reported that they are coping well with lupus, 78%, and that other family members are understanding and supportive, 72%. People with lupus, they named other family members, 84%, and friends, 72%, as their primary support network. The survey participants cited pain, 65%, lifestyle changes, 61%, and emotional problems associated with lupus at 50% as the most difficult factors for coping with lupus. So that's a little bit about lupus. Hopefully it's giving you a little bit more of insight as to how many people are affected with it and how it affects people and what the disease is. And so that's pretty much it for this video. I'm just going to end it with showing you guys the t-shirts that I have made. And they are purple shirts because purple is the lupus color. And it has a butterfly because the butterfly is the lupus symbol. Because most often lupus patients will have a rash that goes on their nose and their cheeks, and it's called the butterfly rash. So butterfly is our symbol, and it says I wear purple for lupus awareness. And I am going to be selling these shirts and all of the proceeds from the shirts will be going to the Lupus Foundation of Ontario. So if you guys want to help out a good cause and wear a pretty purple shirt like this, you can click the link in the description below and it will take you to the shop where you can purchase them. And I'm not just having them up for the month of May, I'm going to keep them up in the store forever. So anytime anyone ever purchases this shirt from my store, the proceeds will go to Lupus Ontario. So I hope you guys will go check it out, and thanks so much for watching, and I will see you in the next video. Bye!